This is a webinar in regards to COVID-19 or coronavirus, information for homeless persons and service providers, given on behalf of San Joaquin County Public Health Services. So what is coronavirus? Coronaviruses are a large family of viruses that causes illness ranging from what we know as the common cold to others that are more severe, such as MERS or Middle East Respiratory Syndrome or SARS, severe acute respiratory syndrome. COVID-19 is a new strain that was discovered in 2019 and has not been previously identified in humans. Originally, coronaviruses were transmitted from animals to people. So how does coronavirus spread? The virus is thought to spread mainly from person to person and between people that are in close contact with each other. Coronavirus is spread through inhaled droplets when an infected person coughs or sneezes, or when someone touches their face after touching any infected surfaces. It can last up to 72 hours on certain types of surfaces. Some more information about novel coronaviruses. Just in general, viruses cannot be cured with any antibiotics. The exposure risk is harder to contain than any bacteria, and the immune response is systemic, meaning the entire body is affected. So every year we have a cold or a flu season, and those are very predictable. But before winter 2019, the novel coronavirus has not been seen in humans. So flu is our enemy that we know, but this new virus is an unknown enemy that our bodies don't know how to mount a response to yet.
So current COVID-19 status. In California, we have 30,333 cases and 1,166 cases as of April 19th. In San Joaquin County, we have 428 cases with 17 deaths as of 4/20 or April 20th.
Homelessness in San Joaquin County. Because of the higher likelihood of pre-existing health conditions and the transient nature of the homeless population, people who are homeless or at risk of homelessness and the people who interact with this population may have an increased risk of COVID-19 infection and a greater potential to increase COVID-19 transmission. We would like to share some data points that we have received from the Homeless Initiative from the San Joaquin County Administrator's Office. We'd just like to note that this is the data for people who were seeking services in the year 2019. So 93% of the homeless are under the age of 62. So that means most of our homeless population is under the age of 62, which is a good thing because we know that older adults are at a higher risk for complications of COVID-19. The unfortunate truth is that because COVID acts a lot like the cold and the flu, all of our low-risk youth and adults will likely be infected and can act as carriers for the disease. This can contribute to the community-wide spread of COVID-19 and potentially infect those who are older or immunocompromised. Speaking of the immunocompromised, we do know that adults with chronic conditions like diabetes or heart disease have more severe symptoms of COVID-19. Less than 10%, or exactly 9.8% of our homeless population identify that they have a chronic health condition. However, this does not take into account any undiagnosed conditions or those who were not enrolled in our county programs in 2019. Currently, 12.9% of our homeless population has an existing mental health condition. So, California Department of Public Health, or CDPH, has issued guidance for limiting social gathering and implementing social distancing of 6 feet or more. Although tents are considered an acceptable barrier for social distancing, many of those who are in shelters or in tents or in encampments can already feel quite isolated, and our guidance from CDPH can actually exacerbate those feelings of social isolation or paranoia. In addition to that, those experiencing homelessness lack access to any good hygiene tools like running water for hand washing. So what are the symptoms of COVID-19? The three symptoms that we see the most are mild to severe respiratory symptoms. So that can include fever, cough, or shortness of breath. Occasionally, we do have some GI symptoms. So moving into prevention. Early action to slow the spread of COVID-19 will help keep staff and volunteers healthy and help your organization maintain normal operations. So wash your hands often with soap and water for at least 20 seconds, especially after you have been in any type of public place or after blowing your nose or coughing or sneezing. Use a hand sanitizer that contains at least 60% alcohol. If soap and water are not readily available, then you can use hand sanitizer. So make sure you cover all of the surfaces of your hands and rub them together until they're dry. Additionally, avoid touching your eyes, your nose, or your mouth with any unwashed hands. So even though your hands may look clean, they can still have germs. These are some helpful songs that we encourage your staff, or encourage your clients to sing while washing their hands to make sure they're washing them for 20 seconds. So some examples are singing Happy Birthday Twice, Twinkle Twinkle Little Star, and This Little Light of Mine. So covering your cough and your sneezes. Cover your mouth and your nose with a tissue when you cough or sneeze, or use the inside of your elbow. Be sure to throw any used tissues in the trash. And immediately wash your hands with soap and water for at least 20 seconds. As a reminder, if soap and water are not readily available, then you may clean your hands with hand sanitizer that contains at least 60% alcohol. Clean and disinfect. So we ask that you clean and disinfect frequently touch surfaces daily. These can include tables, light switches, countertops, phones, keyboards, toilets, or sinks. If the surfaces are dirty, you can clean them with either detergent or soap and water. Use gloves when picking up used tissues or emptying any waste baskets. Any linens, eating utensils, and dishes belonging to those who may be sick do not need to be cleaned separately, but should not be shared without thorough washing. Instruct your cleaning staff to avoid hugging any laundry before washing it to avoid self-contamination. Also instruct your cleaning staff to wash their hands with soap and water or an alcohol-based hand sanitizer immediately after handling infected laundry. Avoiding close contact. We ask that you avoid close contact with people who are sick and practice safe social distancing. So that means avoiding large crowds, being 6 feet apart from each other, and in this case, tents are appropriate for social distancing if shelter is not readily available. We ask that you arrange any beds or mats at least 3 feet apart and request clients to sleep head to toe. Separate your clients with any respiratory symptoms or fever from those who are healthy or asymptomatic. We ask that you try to designate a separate bathroom and keep families together. For any of your staff or volunteers, we ask that they stay home if they have any respiratory symptoms or fever. Also, we ask that you stay home if it is not essential for you to go to a public place. So some examples of essential places to visit are grocery stores or pharmacies to get necessities such as household items, food, and medication. Creating a preparedness plan. So there are a few items that we ask that you do in order to create a preparedness plan. So plan for higher shelter usage during the outbreak. We ask that you talk with those who need to be included in your plan. So meet with your staff and partners to discuss what to do if a COVID-19 outbreak occurs in your agency and what the needs of each person will be. Identify a list of key contacts and create an emergency contact list. Ensure your agency has a current list of emergency contacts for staff, the local health department, and other community resources. Plan ways to care for those who might be at greater risk. Identify a list of healthcare facilities and alternative care sites where clients can seek housing and receive appropriate care. We also ask that you include contingency plans for any increased absenteeism and also update your sick and leave policies. So time is of the essence. Have any gear, have any policies in place before an outbreak happens. And we encourage your staff to have a personal plan. So plan for those who are homeless and are at a higher risk. Older adults and persons who have underlying chronic medical conditions such as heart disease, diabetes, asthma, and lung disease may be at risk for more serious complications. It is extra important that we take actions to protect those who are at a greater risk of getting sick with the disease by stocking up on supplies, so that can include non-perishable foods as well as medications. Take everyday precautions to keep space between high-risk individuals and others. When out in public, high-risk individuals should keep away from others who are sick and limit close contact and wash their hands often. Avoid crowds and encourage social distancing, so 6 feet apart, and having high individuals stay home as much as possible to further reduce your risk of being exposed in your community. Additionally, we just ask that you know what medications your clients are taking. Keep clients and guests informed. So post signs around your space, around your shelter, or any high traffic areas that remind people to cover their coughs and wash their hands often. We ask that you address any potential language, cultural, and disability barriers. For example, providing educational materials for non-English speakers. We also encourage ill staff or volunteers to stay home or either be sent home if they develop symptoms while at the facility, and this will help to prevent transmission of the infection to others. Reducing the spread of COVID-19 is one of our most practical ways of eliminating this public health crisis. If you or someone in your home gets sick, stay isolated except to get medical care. Most people who are mildly ill with COVID-19 are able to recover at home, approximately 80% of people. But they should still not leave the home except when they go see their medical care provider or they're admitted to the emergency department. And we ask that they do not visit public areas, even if they are feeling better. Make sure that people who are ill are staying in touch with their primary provider. Call them before they go in for medical care. Make sure the doctor knows that they're coming in, and they should wear a mask when they enter any medical facilities. People who are ill should also avoid public transportation, including buses, ride-sharing like Uber or Lyft, and taxis. Avoid sharing personal items. Do not share dishes, drinking glasses, cups, eating utensils, towels, or bedding with any other people, particularly those who are ill. Wash each item thoroughly after use. After using these items, wash them with soap and water or put them in the dishwasher or washing machine. Regular soaps and detergents should be fine, especially if they have a heating cycle. And isolate symptomatic clients. For shelters and housing agencies, identify a space to separate the ill from others, and if possible, have them use a separate bathroom. Also, avoid or limit contact with pets and animals. Advise clients to make a plan for someone to watch or shelter their animals if they should be isolated. It's likely that clients will not be able to keep their pets with them wherever they are housed. If you or a client is sick, make sure they wear a face mask when around other people and before entering a healthcare provider's office.
If a person is sick and they're not able to wear a face mask because they have trouble breathing, then ask them to separate themselves from others by keeping them in a separate room or at least 6 feet away. You can create your own cloth face mask, and your cloth face mask covering should fit snugly but comfortably against the side of your face, should be secured with ties or ear loops, include multiple layers of fabric, at least 2, and allow for breathing without restriction. It should be laundered often, at least once or twice a week, or every other day, and machine dried without damage or changes to the shape. And CDC recommends wearing cloth face coverings in any public setting where social distancing measures are difficult to maintain. It's important to note that cloth face coverings should be used in conjunction with social distancing and other means of protection. Monitoring client symptoms. Follow care instructions from healthcare providers and local health departments. Emergency warning signs of COVID-19 require immediate medical attention and include, but is not limited to, difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to rouse or wake up, and bluish lips or face, which is a signification that the person is unable to get enough oxygen. Identifying and reporting COVID-19 cases is also important at this time. Many people who have COVID-19 are able to recover at home without medical treatment, so it may be possible that they call their provider and the provider does not require them to be tested. That person should still be isolating at home. But if you think your client should be evaluated for testing, have them contact their healthcare provider or call their healthcare provider for them or their regular source of care. And the healthcare provider is the one who determines who needs testing and hospitalization on a case-by-case basis. For any medical emergencies, call 911 immediately. If a client has a medical emergency and has any of those symptoms, those emergency symptoms, notify the operator that you think they might have COVID-19. This gives the operator and the emergency responders time to prepare themselves with personal protective equipment and also prepare their transportation vehicle for exposure contamination controls. And if possible, provide the infected with a face mask before medical help arrives. So when someone has COVID-19, they're likely to recover at home, as we've mentioned, but how long should they be isolated, and how do they discontinue isolation? The best way to determine if you're still contagious and you can leave home after these 3 things have happened is, number 1, you've had no fever for at least 72 hours or 3 full days. Number 2, all other symptoms have improved. For example, when you cough or shortness of breath have improved. And number 3, at least 7 days have passed since your first symptoms have appeared. Other adverse outcomes related to COVID-19 are related to mental health, behavioral health. People may respond more strongly due to the stress of COVID-19 and other crises. Older people and people with chronic diseases who are higher risk for COVID-19, children and teens, people who are helping with the response of COVID-19, like first responders, primary physicians, and so forth, people who have mental health conditions, including problems with substance abuse, especially those experiencing homelessness, are just a few examples of people who may have more intense responses to the anxiety of COVID-19. So at this time, it's also really important to remind staff that it's important to support yourself and remain calm. Take breaks from watching, reading, or listening to the news stories, including social media. Hearing about the pandemic repeatedly can be upsetting, even for the most level-headed. Take care of your body. Take deep breaths and stretch, and meditate. Try to eat healthy, well-balanced meals and exercise regularly. Get plenty of sleep between 7 and 9 hours each night, and avoid alcohol and drugs because it depresses your immune system. Take time each day to unwind. Try to do some other activities that you enjoy, like painting or puzzles, watch your favorite TV show, or Skype with a friend. Talk with other people. Try to talk with people that you trust about your concerns and how you're feeling by phone or by video chat. Use other forms of social media, things where you can reach out to people that you wouldn't typically talk to as well. And calling your healthcare provider if stress gets in the way of your daily activities for several days in a row. Most importantly, we should all prepare for change. Make sure to review your organization's emergency plans, especially related to controlling infectious diseases, and discuss staffing support, client resources, and other operational considerations that may impact how you provide services to your clients. It's likely that staff will be out sick and you won't be able to do all of your organization's functions at the same time. So it's important to assess what is the most important things to continue to provide and how you might be able to cross-train staff. If you need extra support or you find a client is experiencing severe mental health conditions or lots of stress and they're spiraling, there are some national support hotlines that you can provide to them or assist them with reaching. The first one is the Substance Abuse and Mental Health Services Association, or SAMHSA. They have a disaster distress helpline that has tons of resources. On their website, they have a lot of fact sheets and things like that, but they also have two text or call lines where you can call in, and it's in English and Spanish. The National Suicide Prevention Hotline has the same type of approach where they have a talk and text line and also a lot of resources available on their website. Locally, we have some resources that you can take advantage of. San Joaquin Behavioral Health Services has a warm line where if you need someone talked down at that exact moment, maybe they're contemplating suicide or they are very violent or they just need someone to talk them down from whatever they're going through, this line is open for the public. We also have San Joaquin County's mental health crisis line available for public use as well. The Wellness Center of San Joaquin County can be reached. The number is located there. And Manteca has a wellness center, which is a nonprofit organization where staff and individuals who've lived experience in mental health and wellness. It's a friendly place for people who are struggling with behavioral health and aspects of recovery. They are closed to the public right now, but they are still sharing information and services out. So if a client comes to their door, they can receive a packet with some activities and local resources and information to keep them going and to be able to link them to needed resources. So anyone who's wanting information on addressing anxiety or stress, this would be a good place to reach out to. I also want to mention that there are some recovery support online sources for people who want to have connection with like Alcoholics Anonymous or Narcotics Anonymous. There are some web-based or like Zoom-based hotlines that people can use. So what is public health doing? Public health has been quite busy over the last couple of weeks trying to coordinate efforts and maintain communication. Number one thing, we are maintaining regular contact with and following the guidance from the Center for Disease Control and Prevention and the California Department of Public Health. We are working to ensure that our public health care system, first responders, and schools have proper guidance. We're conducting planning meetings with our programs to allow for enhanced response coordination, working to ensure that our healthcare systems, like I said, responders and schools have the guidance that they need, maintaining communication and outreach with federal, state, and local partners, distributing information and updates to healthcare professionals and educational settings, and we're reviewing and adapting current pandemic response plans for COVID-19 to our local needs. During this time, it's very important to stay well informed. For up-to-date and correct information, use the resources below. sjcphs.org is our Public Health Services Department website where we have a daily update of the situation, and we also have information that you can disseminate to your clients as well. SJ Ready is the County Office of Emergency Services website, and they have a lot of other county-wide resources for you to view as well. And for community members who are looking for resources, call 211. They are currently contracted with Public Health Services to answer any public health questions, particularly frequently asked questions. And if they're not able to answer your questions, they can link you directly to Public Health Services. Thank you. And if you have any questions or concerns, you can reach us at phs-info@sjcphs.org. Thank you.